Hello and welcome to CNBC-TV18. I'm Shireen Bhan. As India heads towards the centenary year of her independence, it's time for us to reflect on the milestones of the past and also chart out a roadmap for where we wish to be. The government has asked individual ministries to drop an action plan for change with the emphasis on improving the ease of living, the ease of doing business, education, healthcare, climate action and more. Now, while the government readies its plans, CNBC-TV18 in association with IIM Kozhikode has launched a leadership series to engage in a meaningful dialogue to map out what the key drivers for our social and economic growth should be, to capture our aspirations as a nation and draw up a charter of change that will shape the idea of India in 2047. Known as the world's pharmacy, India exports more than $20 billion worth of affordable medicines annually and fulfills over half of the global demand for vaccines. In fact, Made in India COVID vaccines have saved lives in as many as 96 countries. Closer home, the pandemic has brought pace and urgency to reinvent outdated healthcare delivery models. The groundwork for digital transformation of healthcare is underway with the National Digital Health Stack, and data is encouraging with 400 million smartphone-friendly Indians having used a digital health service at least once. Playing their part, more than 7,000 health tech startups are bringing digital costs for India's broken healthcare system. However, let's not forget, for India to become the world's laboratory for tech-led innovations in healthcare, it needs not one but several booster shots. Research-linked incentives are perhaps required for India to move up the global healthcare value chain. While the annual budget allocation for R&D remains below 1%, India's overall healthcare expenditure of around 2% of its GDP also falls short of the global average. One of the key pain points is fewer primary healthcare centres, despite the country being largely rural. Consider this: the proportion of primary health centres with doctors has only gone up marginally from 17.5% in 2005 to 21.8% in 2021. Even though private healthcare providers aim to plug the gap, every year over 100 million Indians slip into poverty due to out-of-pocket health expenditure. It is clear without adequate investment in the two ends of the spectrum, that's advanced medical research and primary healthcare, digital technologies will only provide a chariot without wheels. Well, joining me now to talk about the future of India's healthcare sector are Kiran Mazumdar-Shaw, Executive Chairperson of Biocon, also with me Sunita Reddy, Managing Director at Apollo Hospitals Group, and with us Professor Debashish Chatterjee, the Director at IIM Kozhikode. Kiran, Sunita and Professor Chatterjee, many thanks for joining us here on the program. Kiran, I want to start by asking you, this is something that we've discussed several times over the course of many years, and especially around the time of the budget. Let's start with the investment piece, because as we pointed out, out-of-pocket expenditure on healthcare is amongst the highest in the world, and that puts a burden on the common citizen, on the Aam Aadmi. The budget allocation, now edging closer to 2%. The expectation is that it should be 2.5%, and you want it to be as high as 5% of GDP. We don't know when we're going to be able to get there. But how do we drive more investments? How do we break this cycle of underinvesting in healthcare in India, and the role that both the government and the private sector can play?
Well, this is a very loaded question, Shireen, which is very difficult to answer in terms of how do we get there. But the fact is, we have to invest more. And to me, I believe that this is an opportunity that the country has to leapfrog our healthcare system, which is really very, very weak and needs to modernize. And I think, digital technologies, in my view, are going to play a very important role to improve that infrastructure. And I'm very excited with what the Ayushman Bharat digital mission is all about. So I think one thing is about resourcing the healthcare system, but the other point is about effectively and efficiently managing those resources. And I think digital technologies will definitely allow you to resource them more efficiently. And I think that's what it's all about. So to me, even if you're inching towards the sort of 3% or 2.5% of GDP levels, I think the bigger focus for us needs to be about leapfrogging using technologies, making our systems much more efficient, and really, making sure that we optimize our resources through technology.
Yes, technology is going to play an important part, but on the resourcing aspect that you bring up, Kiran, I mean, you talked about the National Digital Health Mission, the financial support for the health mission for FY22 to 23, and we're talking about digital health mission is up from 30 crores to 200 crores year on year. The World Bank has also approved a $1 billion loan for Ayushman Bharat Health Infrastructure Mission as well. But clearly, that's only the tip of the iceberg in terms of the kind of investments that are required. Sunita Reddy, let's start with that. The kind of investments that require to go into India's broken healthcare system. I know you have previously, in several of our conversations, especially around the budget, talked about the need to promote healthcare REITs, for instance, as an instrument. What can we do to break the underinvestment in healthcare? What kind of options and instruments does the country need to look at?
I think first we should look at what the country needs, and definitely to build our social infrastructure, the country needs healthcare, so it should be given priority. The second aspect of it is to look at healthcare very much as what we can do for the rest of the world, and I think that health tourism was part of it. What essentially corporate healthcare brought to India was the ability to deliver healthcare at 1/10 of the cost. And therefore, we became a very viable destination with great clinical outcomes for international patients across the world. So, I think that when we had reached this level, we said we really need to be able to scale this model. To scale the model, while we had developed the clinical model of scaling, we needed the infrastructure and we needed the skilling. So investments in infrastructure at that time, when you have 9 beds per 10,000, there's a huge demand, and you really need to double the number of beds so that we can serve the entire population. And definitely, infrastructure is a place which India really lacks. And it becomes expensive for corporate players to buy land, to build the building. But if we could focus on operating models to equip and operate, I think it does make a lot of sense. The second thing is, the government has done a lot with regard to private medical college regulations. And we've seen, an almost doubling of the number of medical colleges and the incentives that the government is giving, which is allowing local municipal hospitals to partner with private medical colleges so that, we don't have to really set up the hospital along with the college. This is a huge incentive, and I do believe that the number of doctors that we have will definitely increase. The third is, the digital ability. What can we do with digital? Because that is the future. If you look at digital, what we did during COVID is really we had a digital training session where we upskill nurses so that they could manage, they could manage the ICCUs, the ventilators. And I think digital is a whole new way to look at how we can upskill and train the future workforce in healthcare and also contribute to the rest of the world. I think the fourth thing I'd like to say is that with Ayushman Bharat, we covered a lot of India, about 35% of India was covered. But I think the missing middle, this is something that, we can work with the National Development Health Mission.
Several important issues that you raised there, including that of the missing middle, Sunita. But Kiran, let me address that issue that Sunita brought up in the context of what needs to be done to ensure that we have better staffed, better resourced, and just more access to primary healthcare. Is there a way that we can look at the private sector's involvement, especially when we talk about building out the primary healthcare system in the context of being able to leverage technology? To Sunita's point, can we look at models where it's government infrastructure but operated and managed by the private sector? Is that something that we can consider? Because, you want these services to be affordable, you want these services to be efficient, but at the same time, you want these services to be accessible to a large chunk and large population of this country.
So, Shireen, let me answer that question in two ways. I mean, I think all the solutions of the country are not just about involving private sector in everything. But I do believe that, telehealth has a very big role to play. So interconnecting the private sector with the primary healthcare system using telehealth is certainly a very big opportunity that we have to basically bridge this deficit. Secondly, I think, yes, we all agree that, management of these primary health sectors is proving to be a big challenge. And we know that in rural areas, it is very mismanaged, it is undermanaged, it is not even managed at all. So I do think we need to focus on how do we manage the rural primary health centers in a better way. I'm sure if the private sector was given a model to operate or manage these a set of primary health centers and triage them with the private hospitals or the tertiary care government hospitals, I think it could be a very, very interesting model. But I think we have to find the financial and economic model that makes sense, because otherwise it will ultimately end up being a CSR activity, which we should not get into, because I think it needs to be a sustainable model. And that's why I believe that, yes, I think there is a huge opportunity for public-private partnership in primary healthcare and in triaging to secondary and tertiary care centers, whether they are in the private sector or in the government sector. And there I believe that digital health does make a big difference, telehealth does make a big difference, and we need to create those bandwidth, the required bandwidth to make all this possible.
Is it going to be something that will be economically viable, will be commercially viable for private sector healthcare service providers like yourself, Sunita? And I know that this is something that has been on the table, often discussed, but we haven't really seen any forward movement. Is there a space and opportunity for players like yourselves, or would this open up avenues and opportunities for some of the healthcare startups to look at interesting ways of being able to develop a sustainable model around this area?
Yes, first I think Kiran is right. Telemedicine is really a way to bridge the distance. It's also something that's scalable, which is important, because we don't need, we should be touching not just 1 million or 5 million lives, but make an impact with 100 million. In Apollo, in fact, we've worked with many governments. If I take Andhra Pradesh as a case study, we've done 164 primary healthcare centers where we use telemedicine, and we've touched over 5 million lives. So clearly it is a model. Is it sustainable? I think, the government and private sector need to have these deep conversations. And I think this is a huge opportunity for the startups. So we've done UP, Chhattisgarh, Jharkhand, AP. So if Apollo can do that, I think, it's a huge opportunity for many.
Okay, it's an opportunity for many, and you're saying that it is being done at this point in time. The question, though, is one of being able to do it at scale and replicate it across the country. Time for us to head into a break, but when we return, we continue the conversation on India's healthcare services sector and what it could look like in 2047. Welcome back. You're watching India 2047, and we're discussing the road ahead for India's healthcare sector. Kiran, where do you believe India's strengths and advantages lie that should be leveraged as we look at India 2047 from a growth perspective?
Well, in every one of these cases, whether it's cardiac care, cancer care, the new advanced therapies like you just mentioned, CAR-T, probably even gene therapies in future, I think India can certainly provide a very attractive and competitive cost base, which augurs well for medical tourism. And of course, you've seen that in many parts of these medical systems, there is a very, very strong pull for medical tourism. But having said that, I think we should also make sure that we use our own cost base and the sort of competitive cost base that we have for our own use. I think we first and foremost need to improve the standard of care across the board, because we know that there's a huge, huge difference between the standard of care that is available in a country like India and compared to the standard of care that's available in other parts of the developed world. And I think that is a gap that we really need to look at and see how we can cover it. Because the biggest problem we have in our country is about poor outcomes, poor standard of care. And so we need to think out of the box. How do we basically also reduce out-of-pocket spends. A lot of out-of-pocket spends happens because we diagnose very late, the treatment costs escalate, and then, we are not able to sustain the cost any longer. So I think there are lots of things that we can do, but for me, I think we are very cost competitive. We do have advanced capabilities, but we first need to also see how we can use it for our own benefit.
Yes, and that is certainly the hope, and that should be part of the plan. But Sunita, to address this healthcare demand-supply gap that we've been talking about through the course of the program, whether it is on the bed side or the diagnostic side, if I were to ask you to map out a charter of change in order of priority, and we've spoken about some of those issues, but what to your mind will need to happen, at least in the short term, medium term and the long term? Let's address what needs to happen in the short term to build the bridge to the medium and the long term goals.
So I think in the short term, clearly the investment in preventive healthcare. Kiran spoke about that, but for every 1 rupee you spend, you save 6 rupees. So if you look at the healthcare continuum, most of the money is spent at the end, because patients, people, consumers are not looking after their health. And I think digital health has a huge role to play in keeping people healthy, because when we started, life expectancy was 60. And now it's, about 30 years ago, it was about 63, and now it's 72. Moving into 2047, this number is going to increase dramatically. So I think it's more about, instead of adding years to your life, quality to those years.
Yes, as we get older, the hope is that we will continue to enjoy a quality life. These are critical challenges as well as critical opportunities that need to be addressed. Kiran and Sunita, always a pleasure. Thanks very much for joining us here on the CNBC TV18 special conversation as we talk about the roadmap for 2047 with a special focus on the healthcare services sector. Thanks very much for your time. Joining us now is Professor Chatterjee. He's also been listening in on the conversation for India at 2047. Professor Chatterjee, many thanks for joining us, and I want to understand from you, you've heard both Kiran as well as Sunita. Let me ask you to crystallize for us what you believe will need to be prioritized.
Thank you, Shireen, for having me here as we discuss one of the most pressing issues of our country as we prepare to be a leading nation in 2047. Philosophically, we have to recognize that while death is non-negotiable, healthy aging and journey to the inevitable mortality that we all face should be a privilege and not just a pain for our people. That is the meaning of the word Ayushman, blessed and not cursed with a long life. Etymologically, the word Ayurveda means the same thing, knowledge of such a long and healthy life. Look at the 3 Ds that IIM Kozhikode has looked at by way of lenses for transformative action. The first of the 3 Ds is digitization. Now, digitization has to move away beyond the technology aspect. Although digitization will continue to improve healthcare in both scope and scale, there is a more critical issue. What is the critical issue? It's the mindset towards adoption of new technologies and openness to look at pathways of care from the new angle to see how technology can enhance the patient experience. Innovation is happening not just in the technology part, but in the undefined relational space between the patient and the care provider. We have to adapt technology towards preventive healthcare, not just to enable patients to survive, but also to thrive, as pointed out by Ms. Sunita Reddy. Diversification also implies that, as you mentioned, Shireen, has to be the core of a differentiated healthcare system. To succeed, you have to look at the ASHA workers and the tremendous work they did for COVID-19, but they need more expert service, more expert help. There has to be a greater synergy between our diverse stakeholders in healthcare. The 2016 edition of the World Economic Forum, experts have clearly discovered that misalignment among stakeholders such as citizens, regulators, pharmaceutical and device manufacturers, and insurers, academics, policymakers, investors, they significantly contribute to the underperformance of the health sector. This misalignment is an issue. India has the opportunity to break free and avoid this trap. One disastrous consequence has been healthcare intervention taking place mostly in the last stage or the late stage of illnesses and the resulting high costs. Personal health records, digital health lockers, and portability across open health exchanges are some of the critical components to ensure citizens have access to such services, retain control, and have friction-free experiences.
You know, a lot of emphasis and focus on what digital technologies can do to bridge both the access as well as the affordability divide. I wanted to understand from you, how do you see this playing itself out? Are we betting too much on the prospects of how transformational digital technologies can be, or do you truly believe that this could be a game changer?
Shireen, your question really brings me to the third D after digitization and diversification. We will call this disruption, which you call game changer. We have seen how COVID-19 broke down barriers, real and imagined, and made possible what was earlier thought to be impossible. Vaccines developed at record speed. Telemedicine adoption became real. Doctors started monitoring patients in home care. Unprecedented community participation happened. And you could see phone-based symptomatic screening and data-driven pandemic response at various levels were evident. The pandemic has been the disruptive trigger for rethinking the health system in India from the ground up. Both the government and the private players made several changes in the overall healthcare sector to ensure the readiness and resilience of healthcare system in this country. We have to think big in the moonshot mode. Incremental steps alone will not make universal healthcare a reality for 1.5 billion people of India. Historically, missions with 10-year horizons have fared well if disruptive and almost outlandish ideas and goals drive them. Look at these three big ideas: sending a human being to the moon, connecting the world with the internet, a unique ID for 1.3 billion citizens of India. We must find ways to realign our formal health system with our traditional knowledge paradigms that have particular success in preventing chronic diseases. The perspective Ayurveda on food as medicine and personalized nutrition needs to be communicated to our citizenry. The use of sensors for wellness monitoring and gamification for behavioral adjustments in lifestyle for better outcomes should become an integral part of preventive healthcare. I think disrupting and transforming India's massive healthcare challenge is, in the final analysis, not just a technological issue, it is a redesign challenge and ultimately a mindset challenge for all of us.
Professor Chatterjee, always a pleasure. Many thanks for joining us here on India at 2047. That's it then on this special edition from all of us here. For now, goodbye. Thanks for watching.